Welcome everyone. So today's topic will be the Sheehan syndrome. So first we will discuss about कि Sheehan syndrome होता क्या है, that is what is Sheehan syndrome, okay, its pathology, and then in the last part we will discuss about the one topic regarding its MCQ, okay, so what type of the MCQ और किस तरह क्वेश्चंस आते हैं इसमें, ठीक है। तो पहले टॉपिक के रिलेटेड कुछ पढ़ लेते हैं कि शीहान सिंड्रोम है क्या, उसकी पैथोलॉजी कैसी है, ठीक है, कॉजेस क्या क्या हैं इसमें, क्या टेस्ट करवाना, मतलब इन्वेस्टिगेशन में क्या मिलेगा, ठीक है। एंड उसके बाद हम लोग एक एमसीक्यू क्वेश्चंस करेंगे, ठीक है। सो लेट्स स्टार्ट, व्हाट इज योर शीहान सिंड्रोम, ठीक है। सो इन शीहान सिंड्रोम व्हाट हैपेंड during pregnancy, usually during pregnancy we know that our pituitary gland enlarges, okay. So if you see this diagram, so in this diagram this is the pituitary gland, and during the pregnancy this gland enlarges, okay. So during pregnancy even the pituitary gland, it become enlarged, okay. There is an hypertrophy of this gland, hyperplasia of this pituitary gland. In Sheehan syndrome usually occur, the most common cause will be the postpartum hemorrhage. In Sheehan syndrome the usually occur after the postpartum hemorrhage. The most common cause, if they ask you what is the most common cause of the Sheehan syndrome, your answer will be the postpartum hemorrhage. Now suppose when there is an enlargement of the uterus, there is an enlargement of this pituitary gland. So when the enlarged pituitary gland is there, that means it requires much more amount of the blood, okay. This pituitary gland, if it enlarges, if there is a hyperplasia of the pituitary gland, it requires more blood supply. Now, in Sheehan syndrome, usually what occurred after the postpartum hemorrhage, severely if there is an after the delivery, excess of the blood is lost. So this enlarged pituitary, it does not get that much amount of the blood. So there will be a no collateral supply of this pituitary gland. So what happened? There is an pituitary necrosis or the ischemic necrosis of the pituitary gland, and especially anterior pituitary gland is affected, okay. Remember in Sheehan syndrome, anterior pituitary gland get necrosed, not the posterior pituitary gland. So this is very important MCQ. Anterior pituitary gland is basically it get ischemic necrosis of the anterior pituitary gland, not the posterior pituitary gland is, it is basically spared. The most common cause will be the postpartum hemorrhage. If there is an severely blood, that means there is a prolonged hypertension, okay, which resulting in the shock. Okay, so these are the basically the pathology. Now, what are the clinical features you will find in the Sheehan syndrome? The early clinical feature, okay, so that is very important. What is the early clinical feature? That is failure of lactation. So this can be one of the question they can ask in your examination. That is failure of lactation. Okay, this is the most common presenting symptom. If they ask what is the most common presenting symptoms, your answer will be a failure of lactation. Now in anterior pituitary gland, it become necrosed. So what happened? There is a decrease in the FSH and the LH level. Okay, so that means there is an amenorrhea. Prolactin level decreases. We know that the anterior pituitary gland secretes prolactin level. Okay, secretes the prolactin hormone. So decrease in the prolactin gland, prolactin hormones. That means lactation. Okay, so deficient, there will be no lactation. TSH, okay, the thyroid stimulating hormone is also decreases. That means the patient may produce a feature of hypothyroidism, okay, hypothyroidism. And the ACTH hormone, adrenocorticotropic hormone, it also reduces. If I write it here, so if there is a decrease of the prolactin hormone, decrease of the FSH and the LH, which causes amenorrhea, The TSH hormone decreases the features of hypothyroidism. Adrenocorticotropic hormone also decreases because they are all produced from the anterior pituitary. Okay, and we know that the ACTH, if there is a decrease in the ACTH, the cortisol level also decreases. Cortisol is a stress hormone. It is an essential hormone which maintains the BP. If there is a less cortisol, that means the person suffer from the hypotension. It is cortisol also help to that is help in the glucose homeostasis. That is not possible. So the features of the hypoglycemia, okay, the features of hypoglycemia, and also there is a reduction of the growth hormones. So there will be a fatigue. Okay, so there will be a fatigue. So if they ask you the question, what is the early clinical feature? The early clinical feature will be your lactation. Okay, so this is one of the important question they can ask in the medical examination, okay, in your entrance examination. And if they ask you what is the most common features which is life threatening, then your answer will be the decrease of the ACTH hormones, okay, that is decrease of the cortisol hormone, which causes the features of hypotension and the hypoglycemia. It is a life threatening one. Otherwise the clinical most common and the early feature will be the lactation. Okay, FSH, amenorrhea, TSH features of hypothyroidism is present, but they are not the early features. Okay, but they are not the early features of your Sheehan syndrome. Now, in the investigation, what you will do for the investigation, we will do the MRI. Okay, the MRI. Okay, in the MRI, we will see the empty sella. Okay. It's an empty sella. So if the question asks the earliest deficiency will be the earliest hormone lost will be the prolactin, but it is not life threatening. If the question is your the most dangerous and the life threatening, which is a high yield question, then the answer will be the ACTH hormone. Okay. Hmm. Okay, so now this is the question. Look at it and just tell me the answer. A 32-year-old woman present 8 months after delivery with persistent fatigue, inability to breastfeed. Secondary, there should be an amenorrhea. Okay, there will be an amenorrhea. Okay, secondary amenorrhea and recurrent episode of the hypoglycemia. Her delivery was completed by severe postpartum hemorrhage requiring the transfusion. She has hypotension, loss of axillary pubic hair. Laboratory finding shows decrease of ACTH, TSH, LH, FSH, prolactin, and normal ADH. Okay, and the MRI will show partially empty sella. So this is a diagnosis of the Sheehan syndrome. Okay, so because persistent fatigue due to the decrease of growth hormone. So if you see the GH hormone decreases, inability to breastfeed, that means prolactin hormone decreases, that is why inability to breastfeed. Secondary amenorrhea due to decrease of LH and FSH. Episode of the hypoglycemia due to the decrease of the ACTH. Okay, so you can understand this question. Now, what is the question is which of the earliest hormonal deficiency responsible for the most life-threatening complication in this patient? See, here earliest hormone deficiency will be always the prolactin hormone. But in the question, what they ask about the deficiency responsible for the most life-threatening complication. So the answer will be the ACTH. Okay. So this, if you have any questions regarding the Sheehan syndrome and any topic you want to discuss, you can type me in the chat box. Okay. If you need any questions or in any explanation of any topic. Okay. So thank you everyone.